Hey, Dr. Todd here. Thanks for joining us. Today I want to talk to you about something that's really important, neck injury treatments, different types of treatments out there. If you've had a neck injury, what do most of the professionals out there do, whether you've seen a medical doctor, a physical therapist, a chiropractor, an acupuncturist, what do they do for these? So I have a spine here so I can explain this. Is that if you've had a neck injury, a lot of times you'll have some sort of symptom that tells you you've had an injury. And in one of our other videos, we talk about that a lot of these neck injuries don't produce any symptoms at all. So I don't want you to misconstrue what I'm saying. Presence or absence of symptoms are not the way to know if you've had a neck injury. Let's just say in the case that you have neck pain and you're going into a doctor. A lot of doctors, what they used to do, and some of them still do this, in a lot of cases it's a huge mistake, is they put a brace on the neck. They immobilize the neck. They make sure you don't move it. So now you're moving around like a robot, waiting for the symptoms to hopefully go away. They fill you full of enough painkillers and muscle relaxers to essentially turn the symptom off, and then things just hopefully get better on their own, right? That's something I would not recommend doing for a couple of reasons. And let me explain a little bit about how the body works. So this is the front of the spine, the back of the spine. You have a bone, disc, bone, nerve comes out in between, spinal cord right down the middle. This thing right here is the disc. And what happens is that with these different neck traumas, the head usually gets thrashed around like in a whiplash, and that can cause the segments in the spine to misalign, to shift out of position. That's something we call a subluxation. Well, when that happens, the alignment is physically changed, and our body's very smart. What our body does is it says, uh-oh, that nerve is going to start to have some kind of irritation to it. We don't want that. And so it causes muscles to spasm and splint and lock down and essentially try to protect your body from further injury. It's trying to protect that vital nerve tissue. And so when muscles spasm and splint, what do? We don't like that because it hurts, right? So we go in and we try to get things to make the muscle spasms decrease. But if we don't address the cause of the problem, the reason why the muscles are spasmed and splinted, then what are we doing? We're essentially fighting our body's own protective mechanism. Our body's trying to protect us, and we think we're smarter than our body, so we give it a pill or an injection or something else, and then we're overriding this protective mechanism and we're prolonging the healing process. So medically, a lot of times, they'll put braces on the neck, or they'll give you painkillers and muscle relaxers. That's not always a great solution. There is a time and a place, but in most cases, that is not done appropriately. Believe me, we see a ton of patients with this done, and we take a different approach, and we're able to help them where all these other things are failing. Another thing that's done often is patients go in and they get massage. We love massage. We have massage therapists. However, that's not the solution if you have a misalignment, if you have a subluxation. Because again, the massage is trying to decrease the muscle spasm. Why is the muscle spasm there? Because there's irritation to the nerve. It's doing what it's supposed to be doing. So if we are artificially decreasing the muscle spasm, even with a massage, we're fighting what the body's naturally doing. We have to first get pressure off of that nerve. So I'm going to get to that solution in a second. Let's look at what other professions do. Let's look at acupuncture. Acupuncture also great, awesome thing, helps with a lot of different ailments, a lot of different issues. Let's say in the case that someone has a subluxation, they got pressure on a nerve, the muscles are spasmed. You're inserting needles into the spine to try to override this mechanism, to artificially decrease the muscle spasm. Is that a good thing in this case? No, because you are fighting what the body's trying to naturally do. Again, you are trying to intervene when you haven't addressed the cause of the problem. So we talked about medical approaches, we talked about massage, we talked about acupuncture, physical therapy. That's another thing. Physical therapists, awesome. We work with tons of physical therapists. There is a time and a place for it. However, in this case, again, you know where I'm going with this. The bone's misaligned, the nerve is irritated, and now we have physical therapists trying to stretch the neck and increase range of motion and strengthen different areas. Is that appropriate in this case? Again, no. The only thing that's going to fix this is to specifically find where there's irritation to the nerve and then get pressure off of that nerve. We do that with a very specific form of chiropractic called the Gonstead Method. We can pinpoint that area, we can precisely adjust and correct that joint so that we can decrease the swelling and decrease the nerve irritation. Then we may implement those other approaches in conjunction with what we're doing to get even a faster response. But it's important to understand, first things first, you have to get pressure off that nerve first. So if you found this video helpful, please subscribe to our channel, share this, stay posted for future videos that we're doing. We have tons of great information. We're always trying to keep you in the loop. And remember something we always say, when it comes to the health of you and your family, results matter most.